right, so now we are recording. Everyone, welcome to the Medicare and COVID-19 webinar sponsored by SHIP and SMP. I'm Adrienne Franklin. I am the SHIP coordinator for the Mid-South region, which encompasses Shelby, Fayette, Tipton, and Lauderdale counties. We also have with us the SHIP volunteer coordinator for this region, which is Marcus Stansberry. And we have Lonnie Hitchcock, who is the statewide Senior Medicare Patrol Coordinator, or SMP. And we'll go a little bit into what SHIP is as well in a little bit SMP. I'm now going to turn things over to our volunteer coordinator, Marcus Stansberry. And again, Marcus, just let me know when you need me to advance the slides.
Okay. Good morning, everyone. My name is Marcus Stansberry. I'm the SHIP volunteer coordinator. As Ms. Franklin mentioned, we cover Shelby, Fayette, Lauderdale, and Tipton, and we are the agent commissioner of the Mid-South. Next slide, Ms. Franklin, if you. Okay. What is Tennessee SHIP? What is Tennessee SHIP? Tennessee SHIP helps Medicare beneficiaries in Tennessee understand Medicare and find the best possible plans available to them right where they live. Our main areas of concentration are outreach, education, counseling, as well as assistance. Ms. Franklin, if you would, next slide. Okay. The overview of this presentation, Medicare coverage of COVID-19 vaccine, Medicare coverage of COVID-19 testing, Medicare coverage of COVID-19 treatments, inpatient and outpatient care, skilled nursing facility care, home health care, telehealth benefits, prescription refills, Medicare Part D, Medicare Advantage plans that we'll go into a little bit more in depth, optional changes, Medicare fraud and abuse SMP, which Ms. Hitchcock will go over as well. Okay. Medicare coverage of COVID-19 vaccine. We're in the middle of a pandemic, as I mentioned earlier. We've been in it since March of last year, March of 2020, and it just felt so good to go, as I mentioned earlier, to go to a restaurant and to not worry about, whether I'm gonna get home again or will something dramatic happen. It's like super awesome. I mean, and so I'm anticipating having a great summer. So, but be that as it may, original Medicare Part D, it covers the vaccine, regardless of whether you have original Medicare or a Medicare Advantage plan. And the beautiful thing about this is that you will not owe a deductible, no co-pays, co-insurances, but you should bring your red, white, and blue card to the vaccine appointments, even if they have a Medicare Advantage plan. If you do not bring your card, your provider may ask for your Social Security number in order to look up your Medicare number and bill information. I think I was watching CNN last night, and they said about 38% of Americans are fully vaccinated. So I'm like, yeah, that's a huge plus because where a person is or where they are not, I'm shooting for everybody. I would love to see nothing more than a country that's 100% vaccinated. Next slide, Ms. Franklin. Medicare coverage of COVID-19 testing. Your doctor can bill Medicare for testing provided after February the 4th, of course, 2020. And Medicare covers your first coronavirus test without an order from a doctor or other qualified healthcare providers. After your first test, Medicare requires you to get an order from your provider for any further corona test you receive. We know and I won't get into this, but we know with, what is it, Johnson & Johnson, you only need one vaccine, but of course the others, Moderna and Pfizer, require two. So there's a little bit more research, I think, that need to be done regarding as far as coverage on those, but not to prolong the time. And the last point on this one is that you will owe nothing for the laboratory test and related provider visits, no deductibles, as I mentioned, no co-pays, no co-insurances. And this applies to both original Medicare as well as the Medicare Advantage plan. Franklin. Mm-hmm. Okay. Medicare coverage of COVID-19 treatments, Medicare Part B, which of course we know that's your medical insurance. It covers the COVID-19 And I want to say say this right. I always have this is a tongue twister. Monoclonal antibody treatment. If all these apply, once again, these must apply. You must test positive for COVID-19. You have to have a mild to moderate case of COVID-19. Uh, you are at high risk of progressing to a severe case of COVID-19 and or at high risk of requiring hospitalization. And once again, you will owe no cost sharing, no deductible, no co-insurances, no co-payments. Next slide, Ms. Franklin. Okay. Inpatient and outpatient care, inpatient hospital care, that's, of course, is going to be covered by Medicare Part A, which is your hospital insurance. Noteworthy is Part A hospital, Part B medical. Um, Standard cost sharing and coverage rules apply. Normally covers semi-private room, but if a private room is required for quarantine purposes, there would be no additional extra charges that's going to apply. The outpatient hospital care covered by Medicare Part B, which once again is your medical insurance, and the standard cost sharing and coverage rules do apply. And I think that's my portion of the presentation. I believe. If next
Alrighty.
slide, Ms. Frank. Okay, yes, uh-huh.
Thank you, Marcus. All right, so let me advance this slide.
Thank you, Ms. Franklin. Thank you.
So
Uh-huh.
now we'll talk a bit about some of the other services and how Medicare relates to that when it comes to COVID-19. So skilled nursing facility care, or SNF or SNF. Now, normally, under normal circumstances, if you are an inpatient in the hospital for at least 3 nights, then when you go to a skilled nursing facility afterwards or within 30 days, your skilled nursing facility care is covered by Medicare Part A. If you don't typically have that 3 night inpatient stay, then that skilled nursing facility care will not be covered under your Part A insurance. However, because of the public health emergency that was declared last year and has been renewed every 90 days, and we are still under the public health emergency, we're not sure how much longer that will be the case. But as of right now, since we are in the public health emergency or PHE, this rule has been waived. This waiver includes, but is not limited to, beneficiaries who need to be transferred to a SNF, but due to evacuations or to make room at local hospitals, then we can waive that 3 night stay. Now, since they are starting to open up nursing homes again, this may not happen as often as it did when the crisis first began. But if that is the case, they can have a waiver for that purpose. Also, if a beneficiary needs skilled nursing facility care as a result of this current PHE, regardless of whether they were in the hospital or not, they can go and get their skilled nursing facility care and have it covered under Part A. So if the reason they're going into rehab is because of COVID, then regardless of that 3 night stay, they are allowed to waive that and get this covered under Part A. Now, typically, Medicare Part A, which again is your hospital insurance, will cover 100 days in a skilled nursing facility for each 60-day benefit period. So let me just talk a bit about that 60-day benefit period. Under Medicare Part A, when you are an inpatient in the hospital, once you are discharged, if you are out of the hospital for 60 days consecutively, then once you pass that 60-day window of being out of the hospital, you start a brand new benefit period. However, if you have not been discharged, you're still in that current period, even if it means you've transferred from the hospital to a skilled nursing facility. You are still in that first, we'll call it period A. You're still in period A for a 60-day benefit period. So while you're in period A, normally 100 days is what you get in a skilled nursing facility. Past that point, all costs revert to you. If you need to stay beyond that, then you would need to qualify for a new 3 night inpatient stay in a hospital. And then that would give you a new 60-day benefit period. You could go into a skilled nursing facility and once again have 100 days that Medicare would be, that would cover in part or all, depending on what days you're in there. However, because of the pandemic, there were times, especially in the height of it, there were times when people either couldn't be discharged because of quarantining purposes. So therefore, they were running out of their 100 days. They hadn't started a new benefit period. They relaxed the rules and allowed them to restart their 100 days without having to go back and be recertified by going into the hospital again for another 3-night stay. So that rule was relaxed. Again, we don't know how much longer we will be in the public health emergency, but while we are covered under that, then these folks will not have to necessarily get a brand new 60-day benefit period before they can have another 100 days worth of skilled nursing facility coverage. So that's a rule that has been relaxed during the public health emergency. Home health care. During the public health emergency, some home health requirements have been changed. In order to receive home health care and have it covered under Medicare, you have to meet certain requirements that would allow you to be classified as homebound. So they've added some additional ways that a person can be declared homebound. So if your physician certifies that you can't leave your home because you're at risk of medical complications if you go outside, or if you have a suspected or confirmed case of COVID-19. So those would be added to the traditional ways of qualifying somebody as homebound. So if this is the case, if the doctor is like, normally this person really wouldn't qualify as homebound, but because of, whatever conditions they have, I'm afraid that if they go outside, they're going to catch it. Uh, in that case, they'll now be considered homebound, even if normally they wouldn't be. Also, typically only doctors can be the ones who prescribe care when it comes to home health care. But during the public health emergency, they've loosened that to allow for more providers to be able to prescribe care. So now not only physicians, but nurse practitioners as well as physician assistants can prescribe this care during the public health emergency. And normally there's a face-to-face visit requirement. Typically, you have to have a face-to-face visit with your physician, and then they write the order for the home health care. Because of the public health emergency, they are allowing that face-to-face visit to be met through telehealth, which we'll talk a bit more about in just a moment. So if they do a telehealth appointment, that can count as their face-to-face visit, and then the doctor or nurse practitioner or physician assistant can prescribe the home health care. Also, home health care agencies can provide more services via telehealth as long as those services are listed on that beneficiary's plan of care. So normally the doctor, or now because of the PHE, the NP or the physician assistant, if they have a plan of care during whatever period they say that this person needs to be on home health care, whatever's listed on that plan of care, the home health care agency that they've designated to take care of it will follow that plan of care. Some of those services now can be conducted via telehealth. So as long as that service is listed on the plan of care, they can do telehealth as well as uh, in person. But if it's not on the plan of care, they can't use it. Telehealth benefits. So a telehealth service is a full visit with your doctor using video technology, as well as audio. Sorry, I didn't put that up there, but video and audio technology. And during this PHE, Medicare is going to cover hospital and doctor's visits that are done by telehealth. Mental health counseling can be conducted during telehealth. We certainly want people to continue to get mental health counseling or whatever care that they need. And if they're not able to leave the house, or they're afraid to leave the house, or they're at risk of leaving the house, we certainly want them to still get the counseling they need, even if it's via telehealth. Preventive health screenings can be done via telehealth. So that's another option. And, just other services. If you have Medicare, there are a lot of services that you are allowed now to conduct via telehealth during the public health emergency. Normally, you can use telehealth, but it's for a very restricted set of services, and there's a lot of rules about how to do it. That's been relaxed during the public health emergency. So they've widened the net on what you can do and how and when. You can access these benefits at home or in healthcare settings. Again, that's a change. Previously, before the public health emergency, some services would have to originate at a healthcare facility and do it telehealth, and then afterwards you could do it from home. Now you can start that service from home via telehealth. Now, you still may owe the standard cost sharing. So, just like if you go to the doctor and you would have your 20% copay once the deductible has been met under Part B, that still would apply even with telehealth. Now, if you have a Medicare Advantage plan, definitely contact the plan to see how those services via telehealth would be charged, if there would be any difference from if you had an in-person visit. Also, contact your provider just to make sure you know how they are conducting the telehealth and how they're going to bill. All right, so prescription refills. So, of course, many times, you get your prescriptions and they're written for either 30 or 90 days, occasionally maybe for an off, um, something different like every 2 months, but usually it's going to be 30 or 90 days. Some prescriptions may even be written for just 10 days. Now, if you want to refill your prescriptions early so that you can have extras on hand, not extras so that you can just go woohoo pill party, but extras so that you don't have to get out as much, or you're afraid that something might shut down. Again, this was much more of a concern in the height of the public health emergency, but since we are still in it, these rules are still in play. So you can contact your Part D plan and just say, hey, normally I wouldn't be able to go get this refill until next Saturday, but for XYZ reasons, I need to pick it up Thursday. So you can talk with your Part D plan, and they should remove those restrictions so that you can go get the refill. Also, during this public health emergency, Medicare Part D as well as Medicare Advantage plans must allow you to get a 90-day supply of a drug when you ask for it. However, there are some exceptions. As you can see in the next bullet, they can't provide a 90-day supply of a drug if there are certain restrictions on the amount that can be safely provided. So typically, this would be your opioids. Or any controlled substance, anything that they regulate, they're most likely not going to just give you that 90-day supply because of the emergency. But other drugs, for instance, let's say that you normally get your lisinopril every 30 days, and now you want it to be changed to a 90 days, so you only have to go to the pharmacy once a quarter as opposed to every month for lisinopril. And I believe that's a blood pressure. Don't ask me. But I know it's not a controlled substance. So they should be able to just say, okay, fine, get your 90 days. It's lisinopril. If anybody's getting high off that, good luck. So I can't see it. So they should be able to provide those for most drugs. But there are some that they still cannot provide that 90-day supply. So let's talk Medicare Advantage plans for a moment. During the public health emergency, Medicare Advantage plans must provide these changes that they normally don't. So first, they must allow beneficiaries to receive healthcare services at out-of-network doctors' offices, hospitals, and other facilities. So I remember talking to a beneficiary one time. She lives here in Shelby County, but at the time that this was happening, she was visiting a family member outside of her service area. They didn't want her, I think it was her daughter. They didn't want her to come home. They wanted her to stay there. No, mama, you're not going. I don't know what's going on. Things are crazy right now. Stay here. We'll take care of you. Normally, if you're outside of your area for a certain amount of time, they want you to switch plans or see certain doctors. There's a lot of restrictions. But because of public health emergency, they knew that this was actually becoming typical. People were staying with their children. They weren't traveling. They were, or if they had traveled, they might have been stuck because of the travel restrictions, where it wasn't even so much that the daughter wanted them to stay, but you just can't get on a plane. So for whatever reason, they were outside of their area or outside of their network. So they relaxed the rules so that they could still get services without being penalized. So they could see their out-of-network doctors, hospitals, or other facilities outside of their network, sometimes even outside of their area, and have the same coverage as if they were in their area and if they were in network. Also, Medicare Advantage plans must charge in-network cost-sharing amounts for these services that are received out of network, because again, it's not like the person was just going blatantly, no, I'm not going to see that doctor. I don't care. I'm going out of network and I, demand to go out of network. It was an emergency that necessitated that some of these folks had to go see a different doctor or be out of network. So they're having to charge them the regular amount as if they had seen their typical doctors. Waiving referral requirements. Some Medicare Advantage plans, particularly if they are HMOs, have referral requirements where if you need to see a specialist, you've got to go to your primary care physician first, get a referral to a specialist, make sure the specialist is in network. If it's an HMO or if it's PPO, make sure that they'll take your insurance at a higher cost. They've waived those referral requirements. Also, these plans must suspend rules requiring the beneficiary to tell the plan before getting certain kinds of care or prescription drugs, if failing to contact the plan ahead of time could raise costs or limit access to care. So it's not that they shouldn't still contact their plan, but if they're in a situation where they can't do that, and normally by not doing that, it would raise the costs, they're supposed to suspend that and allow them to just do what they need to do because of extenuating circumstances. During the public health emergency Medicare Part D plans, and again, Part D is your standalone prescription drug plans, must cover formulary Part D drugs filled at out-of-network pharmacies. So again, you may have somebody who is in a situation where Junior told them, "Oh no, Dad, you're staying here. You're not going back." Or they traveled and then there was restrictions. They couldn't get back home for a while. Whatever the circumstance was, now instead of going to Kroger, which was their in-network pharmacy, they've got to go to Vons. That's a California grocery store, and it's not in their network. So they have to cover the drugs that are on formulary. They have to fill them at those pharmacies. Plans must do this when you can't be expected to get at the in-network pharmacy. And they have to cover the maximum supply of the beneficiary's refill at the request. So again, if normally they would only get, carvedilol, 60 pills for a month, but they want to get 180 for 3 months, since I don't believe that is a controlled substance, they've got to allow them to get that at the beneficiary's request. Optional changes. So the last two slides dealt with the changes Part D plans and Medicare Advantage plans must make during this public health emergency. They don't have a choice about those. Here, they've got some optional changes. They've got flexibility. They can do these things. They don't have to do these things, but they are certainly allowed to be flexible. So some of these changes can include relaxing policies to permit mail and home delivery of prescriptions, especially if there's a disaster or an emergency that makes it difficult for the beneficiary to go to a retail pharmacy. So, I know some people choose certain pharmacies specifically because they do home delivery. So if normally your plan wouldn't allow for that, they may allow for it. Now, again, it's not guaranteed. Call your plan and see if they will do this, but the government has given them the freedom to do it if they so choose. Also, they have the freedom, if they choose, to waive prior authorization requirements that would otherwise apply to Part D drugs used to treat or prevent coronavirus, if or when such drugs are identified. And then also, they have the option of removing prescription refill limits. So again, drugs that aren't controlled substances, usually if you request, can I get 3 months instead of 1 month, they'll allow it. But in this case, they're talking about prescriptions that actually have limits on what you can get. It's not so much because, well, the doctor only wrote it for 30. It's not limited. It's just that that's what the doctor wrote it for. So sure, we'll let you get 3 months instead of 1 month. Here, they're talking about prescriptions where there's an actual limit on how many you can get per month or per 90 days. They'd have the option of removing those limits. Typically, again, they won't do it for controlled substances, but if it's not a controlled substance that for whatever reason they've imposed limits on, probably for cost purposes, they can, if they choose, remove those limits. All right, so that takes care of the SHIP portion, the Medicare and the coverage of all the different things. This is our contact information just so you can have it. We're going to switch in a moment to Lonnie for S&P, but I just want to take the time. The Aging Commission, for those who don't know, we have moved. We are downtown at 160 North Main Street on the 3rd floor. No suite number. It's just the whole 3rd floor. It's us. Memphis, Tennessee, 38103. Our toll-free number is there, but also our local number. You can reach us by email at ship.smp@agingcommission.org. We've got our 2 Facebook pages, the Mid-South SHIP page, which is more of a volunteer page, although I'm on there a lot too. I have to talk to them about that. How am I on the volunteer page? Anyway, we also have the Facebook Aging Commission page, which does post a lot of good Medicare information, as well as our Twitter page at aging_mid. There should be an underscore there. And then, of course, there's Tennessee SHIP toll-free number 877-801-0044. Again, you contact the Aging Commission. You can reach me, Marcus. We also have some in-house volunteers as well as some counselors that help with low-income applications. So you should be able to reach quite a few people if you call that main number. So now I am going to turn this over to Lonnie. So let me assign her privileges. So, oh, now that's a problem. Since you're listed twice, I've got to see which one. Well, I'll just try it. I'm gonna try the
Oh
first one,
yeah,
first
you gotta
last
see
name.
what
Yeah, and see if you get the ball. If not, let
about
me
to
know and
raise
I'll
my
try the
hand.
other one.
It worked. I raised
That
my
might.
hand.
Okay, so we've got you there. And
I'll,
okay.
I'll start my video so you can see. So, okay. Lonnie, I'm sorry, Lonnie. I'm sorry. I
Oh,
don't
and
know
for
how to
all of
explain
those
it.
who for all of those who joined while we were presenting, because I couldn't always see your names while I was talking, sorry about that. Welcome and thank you. And if you would go ahead and just type your name in the chat while we are seeing who's getting the ball, we'd appreciate that. So let's see, Lonnie, do you have control? If not, I must have
I
hit
do.
Marcus. You do. Yay, it
I do.
worked.
Yes.
It worked. All
Okay,
righty.
so bear with me while I share my screen here. Maybe. Okay, share. Okay. There we go. All right. All
Oh,
right.
cool.
Can you all see my screen now?
Yes, I can.
Okay. Great. Okay. So good morning. So Adrian did the first part of the ship, and today I'm going to be talking to you about COVID-19 scams. And then we're going to be asking you at the end of our presentation to do a survey for us. This is a satisfaction survey that ACL, who we are grant funded, SHIP and S&P is grant funded through ACL. They're asking us to do satisfaction surveys on any presentations that we do. So if you all could please do the survey. It's a Survey Monkey. It's a real quick, a few questions answered, and I'll show you the link at the end. So, there has been a lot of fraud surrounding COVID-19. Of course, when anything new comes up in the medical field, there's some type of fraud always associated with it. So I'm going to be going over some of the fraud that happened during, while we've got, COVID-19 going on. So, of course, the OIG, the Office of Inspector General, has warned that fraudsters are targeting Medicare beneficiaries through all sorts of different types, through telemarketing, social media, even in person. I mean, there's some that's even, went to door trying to give people fake COVID-19 tests. So we've had some those type of, now that's not happened in Tennessee, but that has happened in other places. But just to make you all aware of that. So there have been, some people going door to door trying to give people COVID-19 tests that were not legitimate. So here's the types of COVID-19 fraud that we have dealt with. And when I'm saying we, we're talking all the S&Ps around the nation. The COVID-19 treatment fraud, there's supplies fraud, and there's other medical services fraud that's been going on. So, of course, contact tracing, that's one of the frauds that people were getting phone calls. These people were claiming to be contact tracers from the health departments, yet the contact tracers were actually asking for like Medicare numbers and things like that. And that's not something normal contract tracers would be asking. They normally did not ask for personal information like Social Security numbers, Medicare numbers, things like that. So, also, real contact tracers will not ask you for any money, credit cards, anything like that. None of the true contact tracers don't ask for that type of information. The contact tracers were only, wanting information of who other people had been in contact with, who had you maybe exposed to COVID-19. That's all that they were telling people, or they were calling and telling people that they had been around somebody that had 19, so COVID-19. So that's pretty much all that was. But they were not asking for any personal information, Social Security numbers, Medicare numbers, credit cards, money, nothing like that. Of course, since we've had COVID-19, we've had these treatment frauds. Of course, right now there is not a cure for COVID-19. But there has been some companies, claiming to have a cure for COVID-19, trying to sell, medicines or whatever online, trying to sell a cure for COVID-19. Of course, as I said, there is not a cure for COVID-19. So if you all see any of these online advertisements, anything like that for a cure for COVID-19, please let me know so we can get them reported to the OIG. Medical care, there's been billing issues, even diagnosis concerns, because there's some out there that they think they were diagnosed with having COVID-19, yet they never had a test or anything confirming that they had COVID-19. So we've had some of those. So because, with the COVID-19 diagnosis, it opened a whole lot of doors for other people. So, and there's some out there thinking they were falsely diagnosed with COVID-19, so they could, either get more, services that were unnecessary, chest x-rays or whatever, and stuff like that. So there's some of that type of fraud going around. As I said, cures, there's not a cure for COVID-19. So if there's anything you're seeing, any advertisements for a cure, it is not a cure. It's all a scam. I said, and here's some of the things that the OIG has actually, or in the Department of Justice have actually, prosecuted people for, alleging, the COVID-19 cures. So, I mean, and these included pills, teas, supplements, oils, creams, you name it, toothpaste even. So that's some of the things that, and it's out there. Every time there's something new that comes along, there's always a scam attached to it. Vaccines, there is a lot of people, getting vaccines now. Just make sure you go to a legitimate place, because there is those telemarketers out there trying to get, people signed up for vaccines. Unfortunately, I know a lot of the aging, the aging commission, and they may be calling people to see if they're, I know here in the Upper Cumberland, we were calling people to see if they were going to go get their vaccines or if they had any transportation issues and things like that. Now, we weren't asking for any private information when we did those phone calls, but we were just curious as to were they getting the vaccine, or is there any, if they wanted to get the vaccine, were there anything hampering them from getting the vaccine? So that's some of the things that others were dealing with. Yeah, so we've had some of those. Now there has been the, fake door-to-door salesman trying to give people the vaccines. I would not trust, if someone comes to my door unannounced, that's usually a big red flag. That is a scam. So you never know, what kind of vaccine those people may be getting there. So you need to go to the legitimate places that are giving the vaccines, and there's several different. If you need to know where to get a vaccine, you can get on your Department of Health website, and there's a link on those as to where you can go get your vaccines. There's several different pharmacies now giving vaccines, Walgreens, CVS. Well, I don't know about CVS. Walgreens, I know. Kroger's is giving the vaccines. Walmart's giving the vaccines. So, I mean, there's several different places besides the health department that are giving the vaccines. But if you really need to know, to check, go on the Department of Health website to check to see, the legitimate places that are giving the vaccines. Supplies, when it first started, we were rampant with fraud in the supply. Doctors' offices were getting faxes for prescriptions for the N95 mask for people that had never requested it. Beneficiaries were getting phone calls wanting to know if they wanted a mask and then asking for a Medicare number and things like that. I mean, it was just absolutely crazy as how much fraud we were getting. Of course, we haven't gotten a lot of that here lately, especially with the supplies, because now, masks are, pretty much rampant everywhere. And the doctors that got those faxes that turned them into me told me that, hey, if they needed a mask, they could just come by the doctor's office and pick it up, or they would even stick one in the mail to them. They didn't have to have a prescription for a mask for them to send them. So that's just some of the things that we were dealing with in the beginning, and it was absolutely crazy. So I said some of the common scams that were the N95 masks were often substituted for the lesser product. They weren't really N95 masks. So it was just rampant. It was crazy how much sanitizer, there's some people making, the homemade sanitizers, and then some of them had to be pulled. So if you need, hand sanitizer, make sure you're getting it from, reputable company and it's not one that's been pulled or anything like that and, hand sanitizers, always good to have. Even when we don't even have COVID-19. So just be careful. Make sure it's not something that's been, pulled off the shelves or something. Of course, other medical services where you got to look for, COVID-19 scams, telemedicine, since everybody was stuck indoors, a lot of telemedicine was kicking up, where the doctors could, call in and you could do a face-to-face over the computer or over the telephone to do some of your services. You just want to make sure everybody checks their Medicare summary notices or the explanation of benefits to make sure, like if there is a telemedicine appointment on there, that's the doctor that that doctor, that's the doctor you actually talk to, you're familiar with, and it's not some doctor in some other different state or something like that. Unless you go to a doctor that's out of state, just make sure you check your Medicare summary notices real carefully. Home health care, same way. Make sure if you get billed for home health care, and they did not come to your house on that date, then make sure, because they cannot bill Medicare if they did not do an actual visit. So keep that in mind. Just make sure you check your Medicare summary notices. Hospice care, there were several people that were falsely accused of being, on hospice. In order to be on hospice, you're supposed to have a diagnosis that goes along with that. For example, cancer, incurable cancer, or something like that. That type of diagnosis, in order to put on hospice. Diagnostic tests. Said make sure you read your Medicare summary notice and things like that. There were a lot of diagnosis tests. We're getting claims through Medicare for diagnosis tests that didn't even associate with the same treatment or whatever. Prescription drugs, same way. Just make sure that and Adrian went over a little bit of the prescription medicines, where you can get the 90-day supply and things like that. So just make sure you check your notices, the ones from Medicare and your prescription drug plan. So telemedicine, there were several that, medical identity theft, misrepresented credentials that they weren't even doctors. Billing for services not rendered, so that's why you really need to look at your summary notices or your explanation of benefits. Offering some of the fake telemedicine doctors are actually offering unnecessary tests or products, or back braces. The brace scam is still going around, and I'll talk about that a little bit later. What you need to be wary of, the unsolicited telemedicine supplies or services. Some of them were offering pain creams and braces, genetic testing, things like that. So just be careful with telemedicine. If you're doing telemedicine, make sure it is your provider, like one that you have a relationship with. You've been to this provider before, and that you know who it is before you do a telemedicine appointment. Home health care, I said there were some, that were billing Medicare for services, even though they never went out to the home. Hospice care, I said, there's several that individuals that were being falsely accused of needing hospice. Yeah, falsely certifying that they were terminally ill. Billing for a higher level of care. So we had several that billing for services not received. We had all that during the hospice care. And some of this is even happening even without the COVID-19. This is some of our normal fraud that we normally deal with on a day-to-day basis. Diagnostic testing, telemarketers for calling people, emailing, text messaging, trying to, solicit COVID-19 testing from people. Seniors were getting the prescription drug, seniors were getting official sounding calls from Medicare stating that due to prescription history, they qualify for, COVID-19 kits. Of course, I said this was not their prescription drug. This was not Medicare calling. This was the scammers calling. So here's some tips to avoid, fraudulent schemes. Be cautious of any unsolicited requests for personal information, Medicare number, anything like that. So be suspicious of any unsolicited, and this is unsolicited phone calls for COVID-19 test, treatment, supplies, anything. I said these scammers were doing unsolicited phone call. They were sending people text messages, emails. They were even going door to door. So keep in mind that only a physician or other qualified healthcare provider should recommend or approve requests for COVID-19 testing. I said if you need testing for COVID-19, you need to go to the health department. The health department will tell you, the people that you can go to, or go to your local doctor or walk-in clinic. Do not trust any of these scammers, especially the unsolicited, where you get the phone calls and stuff like that. And here's our, national, this is my National Resource Center, my SMP resources. So if you need any other stuff regarding COVID-19 fraud, you can go in the smpresourcecenter.org, and we've got all sorts of COVID-19 fraud information up there that you all can, pass out or anything like that. It's a really good information resource. And we do all sorts of different types of, we've got all sorts of different types of fraud stuff, not just COVID-19 on there. So here's some other scams that I've dealt with in 2021 so far. The Medicare brace scam, it is still going on. Beneficiaries are getting calls, cold calls, unsolicited calls from people claiming to be from Medicare, asking about pain, or telling them that Medicare, has approved a brace for them or something like that. That is a scam. If someone needs a brace, they need to go to their primary care physician or one of their, physicians. If they're going to a back doctor or something like that, they need to go to that doctor that they've been seeing. Don't trust any of these phone calls that you're getting claiming to be from Medicare or anything like that. Even boxes of braces have been showing up at people's houses, and they haven't even talked to anybody or anything like that. So big scam going around. The next one that I've been dealing with is genetic DNA testing scam. The scammers are calling beneficiaries claiming that, they're Medicare and that they can approve a genetic testing for them. The other one is the Social Security scam, and the other one is the Irs scam. So as I said, the brace scam, they're getting fraud calls claiming that, they're from Medicare, that offers free or low cost braces, or boxes of braces, which just been showing up at people's houses, or they're actually faxing doctors' offices for a doctor's signature for the braces, even though the doctor has not ordered them, any braces or anything like that. So that's the type of scams we've been dealing with. And I just got one the other day where a beneficiary got a box of braces in the mail that she did not order, hadn't talked to anybody, don't know how they got her Medicare number. It's just crazy. Genetic testing scam. There's been several different ones here. They're calling, claiming to offer free DNA testing for different types of things. Most of them is for, like cancer screening, or the other one that I've dealt with here lately is like heart disease conditions or DNA tests for heart conditions, or some type of cardiovascular thing. So that's the one I've dealt with here lately. They were calling beneficiaries saying that, due to their medical history, that they could qualify for a free DNA test. And they would send them a cheek swab kit in the mail, which they never did. Never got the test kit in the mail, thank goodness. But that, that they can then tell, if they have a history of heart conditions or, supposedly by their, by this cheek swab. So if you, fall victim to anything like this, please call me and let me know so that I can report this to the OIG. The OIG, it wasn't too long ago, maybe 2 years ago, we were dealing hot and heavy with a genetic testing cancer screening scam where they were setting up at health fairs and things like that, doing the swabs there to check for, cancer and things like that. They were actually going to door and things like that. So this one's kind of turned, it's kind of based on the cancer screening. As I said, it's now turned into like the cardiovascular heart condition screening. So it's kind of reinvented itself. But the scam is still a scam. If you all need any of these types of tests, you all need to go to your primary care physician and let your primary care physician order these type of tests if your primary care physician thinks that you need them. And this is all based on medical necessity. These ones that they were getting at health fairs and things like that were not based on medical necessity. And anything that Medicare pays for has to be based on medical necessity. And the scammers were falsifying medical necessity for these tests. Social Security scam. I know a lot of beneficiaries are getting calls claiming to be from Social Security where their supposed Social Security number, and it's not just beneficiaries. Everybody's been getting these calls, not just people over 65. But their Medicare number or their Social Security number has been used fraudulently somewhere. Usually they're saying it's in Texas or, close to the border or, something like that. And that they need, they're coming to arrest you, or that you need to send them so much money for them not to come arrest you, that sort of thing. These scams actually need to report to the Social Security Office of Inspector General, and I've put a number on this slide, and Adrian will send these slides out so you can have that number. But the number to report the Social Security number scam is 1-800-269-0271. So the IRS scam, since it was tax season, and this one actually happens all year. It's not just during tax season, but it seems to be more prevalent during tax season. That, you owe back taxes, and that, they're coming to arrest you if you don't pay over the phone or with, green dot cards or Amazon cards, or, they're asking for some really, off the wall payment things. IRS does not normally call people. They only communicate mainly by phone, or not by phone, but by paper mail. So if you owe the IRS anything, they will send you something in the mail that you owe them. And normal ways of paying them is not by, green dot cards or Amazon gift cards or, things like that. That's not how you normally pay the IRS. So if you get any calls like that, they actually need to report it to the IRS. And I've got actually a link up there to report those scams to the IRS. If, I have a Tennessee Facebook page. I know Adrian says that they have a aging commission page. I've also got a Tennessee S&P Facebook page, so please go and like my Facebook page. I actually post quite a few things, like if any new scams are up there, I usually post those. I usually post something daily on my Facebook page, or at least I try to daily on my Facebook page. So if something's new, this is where I'm going to be posting it first. And I want to thank you all for listening. Here is my contact information. I do have a toll-free number that That's for the whole state. And my toll-free number is 1-866-836-7677. So I'm actually based in Cookeville, Tennessee, but I do work the whole state because I am a statewide program coordinator for SMP, Senior Medicare Patrol. And here's my contact information if you need me or anything like that. And here's the survey that I was talking about. Please go. And this is anonymous. We will not see any of your responses. It actually goes straight to our ACL contractor. So, of course, this is completely voluntary, but we ask that you please it takes less than 5 minutes to complete it. And we ask that you please complete this survey for us. That way, we need as many responses as we can get. And so now on to questions. I'm going to open up for questions for everybody.
Thank you, Lonnie, and thank you all. Yes, we are open for questions. I just want to let you know I did go ahead and put the link for both Lonnie's SMP Facebook page, but also, very importantly, the SurveyMonkey. I've got the link in the chat, so you can click on that and feel free. And of course, we'll be sending this around an email to all of you who participated today. So you'll have the link for that as well. But it is in the chat. If you have not had a chance to put your name in the chat, if you would please go ahead and just type your name for our attendance purposes. And we'll go ahead and open for questions. Feel free to unmute yourself and you can just ask. If you prefer to ask the question in the chat box, you can go ahead and do that. We are still recording. So if you are thinking of a specific case, just use John or Jane Doe instead of folks' names and go ahead and ask away. So we are open for questions about any part of today's presentation. And while you're thinking about questions, I want to clarify. I had mentioned earlier, because somebody had asked me this at a different meeting. So when I mentioned that a beneficiary wants to take their red, white, and blue card to vaccination appointments. Now, of course, we know a lot of the public ones, like if you went out to Pipkin or to Germantown Baptist, the ones that the cities operate and just out there, the pop-up ones, most of those haven't even been asking for insurance. I know they didn't ask me a darn thing. But if you go to, let's say, Walgreens or Walmart, or yes, CVS is now operating and doing vaccines here, at least in Mid-South. I don't know about the rest of the state, but I know they are definitely doing that here. If you do go, they may definitely ask you for the card. Someone was concerned because, they had a friend who went to, I think, Pipkin, which is the city out there in the fairgrounds, for those who don't know. But then someone else went to Walgreens and they were like, well, how come they got asked for their card and I didn't? And that's what I told them. Well, Walgreens is a private entity, so probably they need to charge the administration fee to Medicare. It's still not going to be a charge to you. It's still not going to affect you, but they've got to get paid some kind of way. So they're going to make sure that the government gives them their money. Whereas out in Pipkin, the city, who knows how they've got that arranged. But so don't feel that it's a scam necessarily because when you got your vaccine at a more public, something done by the government that they didn't ask, and someone who went to an actual pharmacy was asked, that in and of itself isn't scam worthy. Now, if someone is asking you for more information than they ought, as Lonnie mentioned, you're getting calls on the phone, or they're going door to door trying to do something. That's something that would raise eyebrows. So those are the things to be more concerned. But yeah, just so-and-so going to Kroger and Randy at Kroger said, hey, I need your Medicare card. That's cool. So any
want to
questions?
add.
Go ahead, Marcus.
No, I just also want to add by way of pop-up sites. Sam's on Highway 64 is I think this is their last week. I was in there Saturday night, and I think this is their last week. And Grady Money on Austin P near Singleton Parkway by Methodist North, they're still their pop-up site is still available. So if you know anybody who's still is desirous of getting the vaccine, those are two additional sites.
Oh, good to know. Thank you.
Mhm.
Well,
Mhm.
I don't see any questions coming through in the chat. So what I'm going to do is I'm going to stop the recording just in case someone might have been shy about asking on the record. So let me go ahead and stop the recording. But again, thank you all. And the survey link is in the chat. And once again, please type your name in the chat so we can have you as attending. But I'm going to go ahead and stop the recording.